Hey there, it's Dominique Well from Well Medical Arts, and I'm going to teach you about the different types of brow lifts. One of the biggest requests that I get is, oh, I feel like my brows are coming down, my eyes look puffy, they look heavy, I need some brow lifts. As we know, Botox is a muscle relaxer, and you relax a depressor and it's going to lift. The bigger the depressor, the more lift you're going to get. So I start out, when we have the 11s in between the brows, the muscles that cause those 11s are the corrugators. When you relax that strong depressor, that's what's going to give you the biggest lift. Because it's the biggest, strongest depressor, it's going to give you the biggest lift. So I start with that first. Then if it's not enough, we can add any of the 3 other kinds. They're smaller muscles, they're minor, but they do work and I do like them. One is a medial brow lift, one is a lateral brow lift, and one's a depressor that's up in the forehead. So the medial brow lift is right above the pupil, and you can do it right above the brow or right into the brow, and that's just going to give a little bit of a lift directly above the pupil. Bring it up this way, and not like crazy bad Botox looking, just a subtle lift. The other one is actually part of the ocularis muscle that when we do the eye, this lateral brow lift will lift up towards the side. And the other one is, as you furrow your brows, there's a muscle that pushes down up here. You can get it to lift up a little bit. So it just depends on how much brow lift people need, how many lifts that we need to do. The first one that we do when we do your corrugators, that's a standard starting dose of 20 units. The other ones are much smaller. I'll use anywhere between 3 to 10 units. So we just add them according to the areas that we want to lift. It gives a really nice result. I'm a big fan of the lateral brow lift to get the tail of the brow, to give a little bit of that gull wing look to the brow. Let me know if you have any more questions.